So we've got Tim Scales, who is the director of entrepreneurship and economic development at Indiana University East. Tim, quick question for you. You have done a lot of research along with medical professionals in determining how we can save hundreds of millions of dollars in cost from our healthcare system. You've come up with some really, interesting solutions. What are those solutions exactly?
Well, Randall, thanks for letting me come on today, and I will talk a little bit about that. One of the things I find fun and interesting is sometimes I work alone, sometimes I work with students, and other times I work with colleagues. And I like to work with colleagues across campus so that it's not just business and economics. And so oftentimes you might have somebody working with me from art, maybe it's somebody from nursing, different professions, okay? Because I think of myself as an expert when it comes to business and economics, but I think of them as experts in their field. And it works perfect because we bring out the best in all of us. But the research I want to share with you today is a more of a practitioner approach of research, which is what I love to do. But it came as a result of the COVID-19. And I know a lot of times we talk about COVID-19 and it's a different type of conversation. But during the COVID shutdown, I was very disappointed. I felt like as professionals, we should be doing something. I felt like we should be the ones out there pushing to figure out the problem and then figure out the solutions to those problems. And so many people were telling me to just stay in, wear a mask, stay in. And that's not what I wanted to do.
Right.
And so one day I was sitting in my living room, staying in, and I thought, no, 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 it's time to do something different. And we're going to make a stance. And so I applied for a small grant. And I called one of my colleagues, I called a couple students, and I said, let's do some research. Let's really get active. And we created hand washing simulation COVID-19. And it's a paper, and people can watch this video. And if they're intrigued enough that they would like to read the paper, I would invite them to do so. But it's basically about educating our youth as we look at safety precautions, which include washing your hands. Now, each of us grew up pre-adulthood. As we went through K-12, we were taught how to wash our hands and when to wash our hands, but I don't know that we ever really understood why. And so we try to put this together to give students as well as parents a better opportunity to do it and understand why they're doing what they're doing. So we tried to partner. Like I said, we got the small grant, and that grant helped us buy some small units. They're hand washing simulators is what we call them, but we've identified them as the billionaire. And the reason the billionaire is going to come up here in my presentation in a couple of minutes. But the billionaire is just this little machine that sits on a desk, and students, adults alike, can put their hands inside of it and look and see what it looks like with germs. We have two things. We have powder and we have a lotion. So we can put the lotion in your hands, we can rub them, and that basically simulates germs. And so then you put it under a black light, which is the billionaire, and you'll see those simulated germs. If the lotion's not for you, then the powder might be. We put the powder on snowballs, on the little cotton snowballs, and we create a snowball fight, and we had people just throwing the balls and having a good time. We showed their hands before and after, and we showed how those germs transferred even on those snowballs. So I think it's very interesting, Randall, because as we did this research and we knew what we were doing and getting into, a lot of things became identifiers. For years, we tell students, we tell children when and how often and how to wash their hands, and that's fine. And I tried to follow those rules before we started this research. And those rules are all in the paper, so a person can go look if they like. But Randall, what I find now is I wash my hands all the time. And it's not just before I eat, or it's not when I've been around somebody who's ill or such. I wash my hands when I go down the staircase. I find myself holding the rail, and you'd be surprised how many germs are on that rail. So there's lots of things that we do. I probably am too fanatic about it. I'm always in there washing my hands, but germs, the way they spread, I spread germs all over this campus in my research. I was able to put the lotion and the powders around, and I would watch, and people would be working at a table, and then they'd go over to like a vending machine, and then the water fountain, and then even to the restroom. And I would take my black light around then and follow, and I seen those germs spread. I would put this invisible powder on the table, and then I'd find it on the soda machine, and I would find it on the water machine. And it's funny how this spread without people even realizing it. So that's why the importance became that we have to be able to look at washing our hands more often than just before we eat and after we're sick people. It's almost everything we do, okay? So beyond that, though, I think the other part of this research that was important was how to partner and partnering with the right people to actually do the teaching. And so I oftentimes use the students, but it's the students in all areas. So students in nursing, students in business. So everybody gets, a contribution to the table. And then we also utilize dentists, orthodontist, fire department, the Boys and Girls Club, K-12 teachers. And so we needed to find that demographics of where we could teach and what we could teach. And I'm going to give you an example of it is we went to the Boys and Girls Club. It was one of the best days I've had. And keep in mind, I started this during the pandemic shutdown, but within 12 months, we were back out doing some things. We were able to get into the Boys and Girls Club. But the fire chief, he was amazing. We had all these children sitting in a room, and he was explaining the importance of safety and things like if you're at home and you smell smoke, there's something going on, okay? When you smell the smoke, there's something going on. Now the smoke alarms are going off. When this happens, we're trying to teach the children safety. Stay low, get out of the house, okay? And he spent a good amount of time on this, and it really drove it home, okay? The students, you could tell they got what he was saying. Smell smoke, you hear the alarms, stay low, get out. Don't worry about the pets. Don't worry about anything except your safety, okay? That's the most important thing. A couple minutes go by, and he says, okay, students, if you smell smoke, what should you do? Little boy raises his hand, and I thought, oh, this is awesome, confidence. And he says, yes. And the young man says, do what my mommy does. Open the window and grab a broom. It's like, wow. So what we found out is that as we teach, we have teaching opportunities and moments that we may not realize. I was so embarrassed for that young one's parents, okay? Because obviously something is burnt probably in the kitchen, and they've opened the windows and they tried to get it out with a broom. But the truth is the fire chief just taught them about the importance of the fire, okay? And so the parents had obviously taught that student already that if you burn something, open the window and air it out. So there was a mixed bag there, but it was kind of an interesting thing. So the importance of actually teaching the students what we want them to really know, okay? And we had to reinforce that. Again, when we did this, and we did this around the safety, and we concentrate on hand washing because we don't want to spread the germs, but we also looked at things like oral health, the fire safety evacuation, physical health, but also infections and health for our community. And one of the things we looked at from this was some stats that are in the paper, and you'll see. But like in 2008, for instance, nearly 61,000 children died around the world due to fire or burns, okay? So we've got to lessen that number. We got to find out ways to help children survive versus die. The other thing that's fascinating, and I continue to use this in my econ classes, but in the United States, on an average year, we spend $40 billion on the common cold. Okay, we could lower that by stop the spread of germs. Okay, so when I walk up the staircase, I've got germs on me. Go into the restroom and wash my hands. Maybe I won't catch a cold today. Okay, so little things like that. If we're spending $40 billion on the common cold and we can find ways to lower it, that's why we call our hand washing simulator the billionaire, because if we can just lower it by $1 billion, and we can do that with that unit, teaching the children, teaching the youth, and teaching the adults about the importance of not spreading those germs. And when we simulate those germs and you can actually see what's happening, it's very impactful. Now, in addition to that 40 billion, in the United States, we spend about $80 billion a year on the flu. And so it's very important. And in the paper, if you read the paper, you're going to see when you should wash your hands and how you should wash your hands. And those are recommendations. And I'm going to, again, say that I would take those recommendations further, because it's as often as you can. And I find myself sitting down to eat with a friend at a restaurant, and I'm like, I'll be right back. And I have to run and wash my hands. And then when I sit down, I'm thinking, Wouldn't you like to do the same? But, it's why we learn in our research, but that's what makes us good instructors and teachers is because we're helping society, we're helping others learn the things that we have learned through our research, even if it's basic practitioner research. And then the other thing is, Randall, something that a lot of people may not realize. I go to the dentist every 6 months, routine cleaning. And when I finish at the dentist every 6 months, my dentist gives me a toothbrush. Okay. And that's all nice. But we found in our research that you really should replace your toothbrush every 2 to 3 months. You shouldn't wait 6 months for the free one. And you should do that every 2 to 3 months because your toothbrush, the brush itself wears down. And as it does, the effectiveness of actually getting your teeth clean is not as strong. So if you really want clean teeth, which we should, or why are we brushing our teeth? If you really want it to work well, I would say replace it every 4 to 6 weeks, but definitely don't wait 6 months because your toothbrush shouldn't last that long. Okay. Then the final thing I want to share with you today as we talk about this research project that we did, I want to talk about the great educational research opportunities and give you some examples. For me personally, I went for 2 grants. I think we could do more. It's just I haven't had time to do more. But I've went for 2 grants and I've received those grants because you just got to know where to go and what to look for. But when you're having the impact that we're having, and you look at the billions of dollars we could be saving, most importantly is just finding ways to make our community healthier. We have worked with 14 schools right here in my area and organizations to include K-12. So I go into 3rd grade classes, but I also go into 11th grade classes. And the 11th graders understand the economic impact, but the 3rd graders understand that they've got to wash those germs off their hands. Okay. And it's fun to watch because they'll come and they'll still see germs on their hands. They'll go flying back to the restroom to wash again and come back until their hands are spotless. And so it's important. And then academic publications. I mean, you're taking on a problem and you're trying to find a solution. And that it's important. We engage our students. We engage our community, but most importantly is the teaching opportunity and the conversations that we can hold. And so, again, we started this pre-pandemic, just a hint, but then we actually dove really deep into it during the pandemic, and we're going to continue to grow with it. So there are so many different ways. Today, I still have 14 schools and organizations utilizing those hand washing simulations. And so it's really good to be able to have this kind of impact.
Tim, that is so cool. How can people, if they want to get these hand washing simulation machines, how would they go about doing this?
Well, they can certainly get in touch with me and I will provide them some information because I have 2 different ones. I have one that I purchased from a source that's just been fantastic. The quality is good. They're still using them, Then I had some that I purchased from maybe a little bit of a discounter. And so we're not utilizing those nearly as much because the condition wasn't as good. So I would say you want to make sure you get good quality because the last thing you want is these not working right. Okay. And truly all you're really needing is a black light, but it makes it more impactful if you can buy the actual unit itself so that kids can have something to put their hands in. So I would say just have them reach out to me, send me an email, and I'll be certainly willing to write back to them and let them know, what I would recommend.
It's so interesting when we were talking. One of the first things that came to my mind, I saw a special once on hotels,
Mhm.
and it said, "Where are the most germs in hotels?" Do you have a guess?
Well, I have a guess of what people think. A lot of times people check the beds, before they get in them and such, if they bring a black light or something.
Right. And that's
But
not it.
but but I know, no, I know it isn't. I would tell you that oftentimes it's the door handles, but that's probably not it either.
You're correct. Door handle was number two. Number one was the elevator.
See, I don't ride elevators,
I
so
know. I know. That's why I brought that up. So
I figured as
you're
much.
safe from germs. You're going to be the only one not getting sick. But
Uh,
if you think about the elevator, people are always touching something,
yeah.
you know, buttons, doors, whatever else. And it's such a closed space that, it's just perfect for the incubation of germs.
Mhm. Oh, Randall, I always have a black light, lotion, and powder right here in my office with me all the time. And I mean, I can stop what I'm doing and do a simulation just right now. Boom. And you'd be amazed because I can. I've got snowballs right here. I can put powder on it. I can toss it to you and we can look under the light and you will be amazed at just how many germs we're spreading.
Yeah. So what potential of these costs? I mean, you mentioned 40 billion for common colds, 80 billion for the flu.
Right.
What would that number be cut down to potentially if people just wash their hands, 10 times a day?
Well, I think the thing we have to remember is what's included in that, because there's a lot of different things: doctor visits, over-the-counter medications, time lost at work, childcare, days off of school. I mean, there's so many things that go into that calculation. And I mean, again, each of us have to be able to do our best to try to make a difference. I cannot take $1 billion off that, but I can make a huge difference just by doing what we're doing. And so all of us working together is going to have an impact on it. There's just none of us want to feel bad. None of us want to have that common cold, nor do we want to get that flu. So take the precautions, but understand why. I grew up K-12 also, of hearing that I needed to wash my hands. I just thought it was made up. I mean, okay. And so I really didn't worry about it so much. It wasn't until I dove into this research that I realized, ooh, when I started seeing those germs spread from the lotions and the powders, and that's another thing I would love to talk to people about. So if they send me an email, but what happens is once you start seeing the simulation, then you really understand what it means. When you say spread of germs, okay, is that the air we're breathing? But when you can actually see it on your hands, I can show it to you on the vending machines, on the doorknobs. Okay, now it's real. Now you two understand it. And so it makes a difference.
Have you seen any increased awareness since COVID with people washing their hands more, using more hand sanitizer products? Because I think the one big difference I've seen since COVID is hand sanitizers are everywhere.
Well, because I think what happens is during COVID, hand sanitizers became that number one thing. That became that giveaway piece. It was the thing we kept telling people: wash your hands, wash your hands, wash your hands. What I do think you need to do is, if you have an opportunity to put your hands in one of these simulators, put it under a black light. I would love for you to do your own test, which I have. And that would be to test those sanitizers. Because what happens is if I give you a pretzel and you're like, oh, I need to go wash my hands, you go to a restroom and you actually wash your hands and you do a great job, then you come back, you should eat that pretzel. But if you don't have that restroom, you're probably saying, oh, just give me some hand sanitizer, boom, put it on your hand, you rinse it in, you're feeling good about the pretzel. But you need to actually put your hands in that, okay, and then put it in the simulator to see if you still have germs. And a lot of times you do.
How effective are those hand sanitizers? I mean, what percentage of germs do they kill when you put it under the black light?
Well, that's another study. So that's a whole nother study that I don't have in this research, but I can tell you that I've tested it, and I'm definitely more comfortable washing my hands.
Fair enough. How long should people wash their hands for?
Well, and again, that's in the paper, and that's what I love about this, is because maybe you'll get teased enough that you read the paper. But in the paper there, it goes into that, and it tells you things like, they always tell you to sing the birthday song, and but I personally think anything that you're told in there, double it. Because you can never be more careful. I mean, they're going to tell you 30 seconds of washing your hands is good, then do it for a minute.
So, Tim, personally, how long do you wash your hands for?
Oh, you know what? If I can get the water warm, it's a good minute to a minute and a half. I hate cold water, so it's like,
In
okay.
a dozen times a day or so?
Oh, you mean how many times a day? I thought you meant how long do I do
No,
it?
no. First, how long, but how many times also?
Oh, Randall, I find myself wash my hands all the time because I've been involved with so many of these simulations. And so what happens is it's just from shaking hands, from going up and down staircases, opening doors. And it's I mean, you like the people, but it's just, come on, we all spread germs, okay? And so I find myself washing my hands probably, I don't know, at least a dozen times a day.
Fair enough. Fair enough. Yeah, it's pretty close to what I do too. I'm pretty obsessive hand washer just because, especially since COVID, that was the one thing. It was kind of like, oh, I need to wash even more now.
Mhm. And I keep hand sanitizer in my car all the time. And you'd be surprised how often I'm utilizing my car. And it's not because I'm consuming anything. It's just that I'm like, I haven't washed my hands in an hour. and then I'm all the time putting the sanitizer on. So and it's not that I'm so, head up with this, but what happens is once you see it and you understand it, I think you look at it in a different way.
Are you getting sick less now?
I really don't get sick a lot. And so
Yeah.
I would have to say I do think it helps. Yes. And taking every precaution, I think that's what's the most important. I can't predict how many times you're going to get sick or whether you're going to get sick less, but I can tell you that anything you can do to take that extra precaution is something that's wise.
That's very cool. Very cool. So, it's very cool that you got students involved and you have the campus involved because I've always said that, having worked at a college campus, it's the perfect incubator for a virus. It's just, and that's part of why they had to shut stuff down during COVID. It's just, you can't keep people away from each other and away from germs. It just will not work.
Right. But I think for me personally and yourself as educators and as professionals, when you try to keep us down and you try to shut us down and take away from what we do, it didn't work. I wanted to come back strong. I wanted to come back stronger than ever, and I did. And so I feel like I was able to make an impact in the world, and that's truly what we should be doing. That's what we should strive for.
I think that's awesome because, I mean, your research has such huge impacts way beyond just academic research. I mean, this is something that you could take through a kindergarten class and start teaching them what germs look like. And I
Right.
think that's totally cool.
Right. And it's hard to imagine what that is, but under a black light, you can simulate these germs really well. So, and you can have fun with them. I've chosen to do the lotion just to be able to put the hands in. I've also chosen to do the powder and sprinkle the powder on the snowballs. But you could sprinkle this powder on just about anything. Okay. It becomes an invisible powder. And so you can just have fun with it.
Very cool. Very cool. All right. Thank you so much for your time, Tim. And we appreciate it. All of Tim's contact information will be placed below. So if you want information on Blacklight, please reach out.
Thank you, Randall.
Thank you.